Canadian nursing leaders say they've sent a message to the premiers during their meeting in Victoria, BC this week that patients and nurses are suffering through a dire staffing crisis that threatens the sustainability of public health care. A statement from Linda Silas, president of the Canadian Federation of Nurses, says the system is on the brink of disaster and nursing leaders shared proposed solutions with Canada's premiers. Ms. Silas says nurses have been struggling through extreme staffing shortages, forced overtime, and canceled vacations. With no end in sight to untenable conditions, the CFNU says its proposals focus on retaining nurses, encouraging them to return to the profession and the public healthcare system, and new measures to recruit and train the next generation. Joining us to discuss the current state of Canada's public health care is Pauline Worsfold, Secretary-Treasurer of the Canadian Federation of Nurses Unions. Welcome to Forum Daily.
Thank you for having me.
Can you start by giving us a brief overview of the situation currently facing public health care in Canada?
Well, you did a good preemptive description there when you said the working conditions are untenable. Nurses are working huge amounts of overtime, including 24-hour shifts in some provinces. There are just no nurses to replace the current nurses who are on shift. Huge amounts of overtime, not being able to take time off to rest and recover. And the people within the system are broken.
What are the main causes for these staffing shortages, do you think?
Well, this is not new, I have to say. We've been sounding the alarm for the past 10 years that we had a nursing shortage over the last 10 years. And of course, the pandemic has only made it worse. It's, magnified the problem, and it's staff shortages related to cutbacks over the previous 10 years. Regarding financial cutbacks, beds in the system have been cut back, so therefore patients face longer wait times, and it's not new.
How has the pandemic impacted the healthcare system staffing situation across the country? You mentioned a couple things. Is there any more than that?
Well, it's made it worse. The pandemic has made it worse because not only do the staff unfortunately contact COVID, but so do their family members. And then that takes them away from work because you can't come to work if you're sick. And so that plus the burnout. We have nurses that we had a survey done earlier this year that showed 50% of nurses were looking at leaving their current job, and 20% of that 50% were considering leaving nursing altogether.
In that line, what will the public healthcare system look like in a year or so if nothing changes?
Well, that's not an option. Something has to change. And coming out of the Premier's meeting, we need action, and we need action right away. We want the federal government and the provincial and territorial governments to work collaboratively to come up with solutions to fix the problem. And we offered solutions in the public system too, I must add. There is no room for a parallel private system. It would just siphon resources, human resources and financial resources away from the public system. So there's no room for a private for-profit system in this country at this time.
So what is your organization urging governments to do to address the situation?
We're encouraging all levels of government, provincial, territorial, and the federal government to come together and listen to the nurses. We have solutions. We're looking at our 3 R's: retaining, re-entry, and recruiting. And I would add a 4th R: you have to do it with respect. And if you can retain the nurses that are in the system, how you're going to do that is you're going to fix the working conditions. The workloads are unbelievable. And the conditions of work are the conditions of care. And our nurses are at the breaking point, and some of them have broken and have left.
Thank you so much for your time.
Thank you.